Welcome to the Clinical Skills Podcast for Electrocardiogram. This podcast will cover the procedure of a routine ECG in an adult patient. ECG is the graphic representation of the electrical activity of the heart, used to detect abnormalities in rhythm and rate. We start with an overview of the indications of an ECG, choosing the correct equipment, standard precautions, anatomy of electrode placement, and the preparation required for the procedure. The procedure of an ECG is illustrated fully, and some of the possible complications are described. Indications for electrocardiogram include chest pain, palpitations, suspected myocardial infarction, abnormal heart rhythm, to check the effects of medication or devices such as pacemakers, and investigation of hypertension, for example, unexplained hypertension. During the procedure, avoid using terms which may cause confusion. For example, the word electrode, which can be replaced with sticky pads. Explain that the pads will be placed on the wrist, ankles and chest, and leads will be attached to these from the ECG machine. For this, the patient will have to expose their chest. Reassure the patient that this is a quick, routine and pain-free procedure. Before commencing the procedure, identify yourself to the patient. Check the patient's name, date of birth, and hospital or community health index number, and confirm this against their wristband. Ensure that the patient understands why they are having this procedure and request consent before continuing. The following equipment is required for ECG: an ECG machine, disposable electrodes, razor blades to remove any excess hair, skin preparation equipment, and ECG paper. Before commencing the procedure, it is important to thoroughly wash or gel hands following the correct clinical procedure. Plug the machine into the power outlet and turn it on. Ensure the time and date settings are correct. Ask the patient to expose their chest and the skin around their wrists and lower legs. If necessary, prepare the skin for placement of the electrodes by removing any excess hair and cleansing with an alcohol wipe. Areas should be clean and dry, which reduces impedance and improves the quality of the ECG. To achieve accurate results, the patient should be relaxed and comfortable. The lower limb electrodes should be placed slightly proximal to the ankle on both legs. The arm electrodes should be placed slightly proximal to the wrist on both arms. Chest electrodes are located by the following method. For V1, using your fingers, count down the ribs to the 4th intercostal space, which lies between the 4th and 5th ribs, and place the electrode on the right sternal edge. For V2, again, count down the ribs to the 4th intercostal space, but place the electrode on the left sternal edge. For V4, find the midpoint of the clavicle and count down to the 5th intercostal space. The electrode should be placed here. For V3, the electrode should be placed midway between V2 and V4. For V5, locate the anterior axillary line. The electrode should be placed here on the same horizontal level as V4. For V6, locate the mid-axillary line. The electrode should be placed here on the same horizontal level as V4. When recording an ECG on a female patient, it may be necessary for leads V4, V5 and V6 to be placed below the left breast. Limb leads should be attached as follows. The green lead should be attached to the left leg. The black lead should be attached to the right leg. The red lead should be attached to the right arm, and the yellow lead should be attached to the left arm. Chest leads should be attached to the corresponding electrodes. C1 to V1, C2 to V2, C3 to V3, C4 to V4, C5 to V5, and C6 to V6. Ensure the patient is relaxed and comfortable to reduce muscle interference. To take an ECG recording, press the ECG button. The ECG machine will start recording and output the results on the ECG paper. Annotate the trace with appropriate information to explain any deviation from the norm. Some patients cannot relax fully due to pain or neurological conditions. Try to make these patients as comfortable as possible.